Hello people, welcome to Crazy Farm, and in this video we will see about anti-leprotic drugs. So these are the various drugs that have activity against Mycobacterium leprae. And dapsone, we have dapsone, clofazimine, and among the antitubercular drugs we have rifampin and ethionamide, and we have two fluoroquinolones, ofloxacin and moxifloxacin. We have clarithromycin, which is the only macrolide which has activity against Mycobacterium leprae, and we also have minocycline, which belongs to tetracycline group of drugs. Among all these drugs, dapsone, clofazimine and rifampin are important because they are used in the multi-drug therapy regimen which is being followed. Other drugs may be used in the alternative regimens. Now let us talk about dapsone. Dapsone is also called diamino diphenyl sulfone. Okay, and please look at the word sulfone carefully. So whenever you look at the word dapsone, it should remind you that dapsone is chemically related to sulfonamide, right? So they have the same mechanism of action as that of sulfonamides. Both sulfonamides and dapsone inhibit folic acid synthesis, and they inhibit the first step itself, where pteridine and PABA react together to form dihydroteroic acid. This reaction itself is inhibited by dapsone and other sulfonamides by inhibiting the enzyme dihydroteroate synthase. Okay, and one more thing to be remembered in this pathway of folic acid synthesis is that we have two drugs, trimethoprim and methotrexate. Trimethoprim and methotrexate inhibiting this enzyme dihydrofolate reductase. So they also essentially inhibit folic acid synthesis. Okay, now what are the adverse effects of dapsone? Dapsone can cause mild hemolytic anemia, especially in patients with G6PD deficiency. And because of this, it is contraindicated in people with hemoglobin less than 7 mg per deciliter. Now, coming to clofazimine, clofazimine has leprostatic and anti-inflammatory properties. Okay, what is the mechanism of action of clofazimine? Clofazimine has multiple mechanisms of action, where it interferes with the template function of DNA. It also alters membrane structure, and it also causes disruption of the mitochondrial electron transport chain. Okay, so these are the various mechanisms by which it serves as a leprostatic drug. What are the adverse effects of clofazimine? Whenever you look at clofazimine, you should be reminded of this adverse effect: reddish brown discoloration of the skin. This reddish brown discoloration of the skin, even though it is reversible and harmless, is one of the major adverse effects of clofazimine, and it can produce other symptoms like nausea, vomiting, anorexia and weight loss, as well as conjunctival pigmentation. Rifampicin. What is the mechanism of action of rifampicin? Rifampicin binds to the beta subunit of bacterial RNA polymerase and inhibits the transcription process. This is the mechanism of action of rifampicin. And what are the adverse effects of rifampicin? Two things should come to your mind mainly, and one is hepatotoxicity. Rifampicin is hepatotoxic, and it can produce hepatitis in people with pre-existing liver conditions, etc. So that's one of the drawbacks. And the other one is that it produces orangish red discoloration of the body fluids. Let it be urine, let it be tear fluid. So these are the two main adverse effects that should come to your mind whenever you think of rifampicin. Leprosy can be classified into paucibacillary leprosy and multibacillary leprosy based on three criteria. We have number of skin lesions to be one of the criteria. The second criteria is nerve involvement. The third criteria is smear. Okay. If the number of skin lesions is 1 to 5, then I call it to be paucibacillary leprosy. If the number of skin lesions is 6 or more than 6, then it is classified under multibacillary leprosy. If no nerve is involved or only one nerve involvement is present, then it is classified under paucibacillary leprosy. And if more than one nerve is involved, irrespective of the number of skin lesions, even if the number of skin lesions is between 1 to 5, if more than one nerve is involved, then it is classified under multibacillary leprosy. Skin smear should be negative at all sites for it to be classified under paucibacillary leprosy. If skin smear is positive at even one site, it becomes multibacillary leprosy. Okay. Now we know what is paucibacillary and what is multibacillary leprosy. Now let us talk about the duration of therapy. Now let us talk about the multi-drug therapy that is being followed. First, observe the duration of therapy for multibacillary and paucibacillary leprosy. The duration of therapy is 12 months for multibacillary leprosy, and the duration of therapy is 6 months for paucibacillary leprosy. And we use rifampicin, dapsone and clofazimine for the treatment of multibacillary leprosy. We use rifampicin and dapsone alone for the treatment of paucibacillary leprosy. Clofazimine is not used for paucibacillary leprosy. What is the dosage of rifampicin that is given for the treatment of leprosy? 600 mg monthly dose of rifampicin should be given under supervision. This is the dosage of rifampicin. What is the dosage of dapsone? 100 mg of dapsone should be administered daily. This is the dosage of dapsone. It's a nice round number, 100 mg. Okay. What is the dosage of clofazimine? Just remember that the monthly dose of clofazimine is half the dosage of rifampicin that we are giving. Okay, clofazimine 300 mg should be given once a month under supervision. And the everyday dose or the daily dose of clofazimine is 50 mg, which is half the dosage of dapsone. Okay, so 300 mg of clofazimine is given monthly under supervision, and 50 mg of clofazimine should be self-administered daily. So this is the dosage of clofazimine. Thank you. If you like this video, please like, share and subscribe.